Channel 2 News begins right now with breaking news.
Yes, indeed. Good morning. 32 days from the election right now, President Trump has announced he and the First Lady have tested positive for COVID-19. Good morning to you. As I said, it's just about 5 o'clock now. I'm Owen Conflinty.
I'm Lisa Hernandez. We're expecting an NBC News special report, and we'll go to that live when it's available. Here's what we know so far on the president's condition. The president's doctor does report the couple are both well at this time. No word if their son Barron is also...
This is an NBC News Special Report. Here's Savannah Guthrie.
Good morning, everybody. We are coming on the air this morning with stunning news from the White House. The president tweeting late last night that both he and the First Lady have tested positive for the coronavirus and are now in isolation. Overnight, the president's physician added that the president was doing well and is expected to continue carrying out his duties. But of course, this raises a myriad of questions on the immediate future of the country's leadership as well as national security. It also adds more uncertainty to the election with just 32 days to go. Our White House team has been working their sources all night. Peter Alexander, let's start with you. And it bears mentioning Hope Hicks, who is one of the president's closest advisors, tested positive for the coronavirus. And in the wake of that, the president and First Lady were tested, and that is when they got a positive result. Bring us up to speed.
That's right. Hope Hicks testing positive Wednesday evening. The president testing positive yesterday evening, to the best of our understanding. Let's walk you through this as best we know it right now. This really was an extraordinary, a stunning announcement that came overnight. About 1 o'clock Eastern time, we learned this news from President Trump, delivering his own diagnosis on Twitter. He said the words that you shared. He said, the First Lady and I tested positive for COVID-19. We will begin our quarantine and recovery process immediately. He added, we will get through this together. The First Lady immediately tweeting her own message, saying we are feeling good and that she has postponed all upcoming engagements. As for the president's physician, Dr. Sean Conley, overnight, he reported, as you said, that the president was well. He did not indicate whether President Trump or the First Lady were experiencing symptoms. He said that the two plan to remain home within the White House here at the residence that's still dark behind us right now during, in his words, their convalescence. He said, rest assured, I expect the president to continue carrying out his duties without disruption while recovering. Still, this announcement, obviously, as you know, really throws the future of the country's leadership into uncertainty. Late Thursday, the president spoke by phone to Fox News. He was the one who confirmed the news that one of his closest aides, Hope Hicks, had become infected by the virus. He said, among other things, that she was a hard worker, that she often wore masks, but did confirm that news. And he also revealed at that time that he and the First Lady were awaiting their own coronavirus tests. Several hours passed while we waited to finally get those results, and ultimately we had them. So in terms of Hope Hicks' situation, she is regularly in close contact with the president. Again, one of his closest advisors. She was with him multiple times this week without a mask at his Pennsylvania rally last Saturday. She flew on Air Force One to the debate in Cleveland on Tuesday.
Let's do the TikTok, Peter. I hate to interrupt you, but if we think of Hope Hicks right now, that she's one of the closest aides to the president. She's the one that we are aware of at this point to sort of be the first in this circle to get it. She was at the debate, as mentioned, on Tuesday night. Now, correct. Tuesday morning, what are the testing protocols at the White House? You know, they mention all the time that people around the president are rapid tested nearly every day. So what would likely have happened? Tuesday morning, she comes to work, they test her, presumably she tests negative, then what happens?
Yeah, so presumably she was negative all day on Tuesday. And then again on Wednesday, as I was saying, she was to be traveling with the president for a rally in Minnesota. She tested negative, we are told, the morning of the Minnesota trip, but she began showing symptoms that evening once in Minnesota. She was ultimately quarantined on Air Force One. She flew back with the president, though quarantined, for their return flight to Washington, D.C. The president last night suggesting that service members and law enforcement officials may have given her the virus. The bottom line at this time is we do not know how or exactly when the president became infected, but this does raise a lot of questions. Among them, at that debate in Cleveland on Tuesday, Tuesday, where it was mandated by the hosts, Case Western Reserve University, as well as the Cleveland Clinic, that everybody in the room, including journalists, it applied to me as well, wear masks when we were inside that room. But when the Trump family arrived there, they were not wearing their masks, or at least if they were, they took them off when they arrived. You saw some of those pictures of them in the room, although the Biden campaign, including Jill Biden, members of the Biden circle, were wearing theirs. So it does raise a lot of questions about who else could have been exposed to this. They're questions that they're still trying to resolve right now. We had a lot of conversations with White House officials as best we could last night, but frankly also a lot of silence from White House officials, except from the president himself, who just yesterday in a pre-recorded set of remarks with the charity dinner that takes place in New York said, contradicting his own public health experts, that he effectively thought that the pandemic, the end of the pandemic, was in sight. Savannah?
Let me bring in Hallie Jackson, our chief White House correspondent, to this. Hallie, and your beat this morning, if you will, is to take a look at who is in the circle. I mean, in a sense, we're contact tracing because the president, Hope Hicks, of course, they're at the very closest echelons, the highest echelons of power. So when you're talking about the president having coronavirus, when you're talking about Hope Hicks having coronavirus, they're interacting with the chief of staff, who then goes over to the Capitol and has meetings with senators. So can you kind of lay out what we know about that kind of tree of contact that's been going on?
So it's a great question, Savannah, and you're right? The president interacts with senior staff who then interact with other people all the time, so the dominoes are falling outward here. So let's take this chronologically, and let's first talk about what close contact means when it comes to contact tracing. Per the CDC guidelines, it's being within 6 feet of somebody for 15 minutes or more, so a sustained period of time. So let's look at what the president has done this week. On Monday, he had an event in the Rose Garden talking about, by the way, COVID testing and the rollout of 150 million COVID tests. He was there. That was the last time we saw him publicly with Vice President Mike Pence. He was there with top cabinet officials, including the HHS Secretary, Alex Azar, as well. Other members of the White House senior staff were in the Rose Garden with him. There was also a truck event that the president held where he had other aides with him as well. So that's Monday. Tuesday is a very critical day, Savannah. Why is that? As Peter mentioned, that was the night of the debate where President Trump got on Air Force One with 20 to 30 family members, friends, people who are close to him, members of his campaign as well. They were on the plane together. That includes, obviously, First Lady Melania Trump, who we know has tested positive for coronavirus as well. It includes top members of the president's campaign, like his campaign head, Bill Stepien, Jason Miller, another top advisor. It includes all of his adult children, including senior advisor and his kids, Jared Kushner and Ivanka Trump as well. And then on Wednesday, President Trump had that rally in Minnesota that Hope Hicks, other staff members joined him at too. Now, Thursday morning is when we understand, based on our reporting here at this time, that Hope Hicks tested positive. That is when the positive test was known. The president still after that got on Marine One with different staff members here, other communications aides, and people who he's close to, got on Air Force One, traveled to Bedminster for a fundraising event. So he was obviously in contact, or at least near and interacting, perhaps from a distance, with people there, and then traveled back to Washington, arriving just about 6 o'clock last night. And then obviously the events of the night that we talked about unfolded. So it is a big circle. All of that is to say there are a lot of people who are going to need to be communicated with here. I can tell you that at least one of the people on Capitol Hill that was with the president on the plane on Air Force One, Representative Jim Jordan, who was at the debate in Cleveland on Tuesday night as a member of the audience, as a guest of the president's. A Republican aide on Capitol Hill says that Jordan, for example, at least before the news came out that the president had tested positive, was not planning to quarantine because of the timeline that we just laid out regarding Hope Hicks testing. So there's a lot of questions moving forward on how this affects not just the president, Savannah, but frankly, the apparatus of government here. I have to tell you, one interesting thing to watch, later on this morning, 9 a.m., Secretary Azar is supposed to be testifying in front of members of Congress. That, as far as we know, is still on, but obviously this is going to be the first and foremost and most important question to him as well, how the White House is set to handle this.
Well, let's bring in a doctor, Hallie. That really sets the stage nicely for us. Dr. John Torres here, NBC News medical correspondent. I mean, I'm looking at a manifest, Dr. Torres, of people who were with the president on Air Force One. It's a big plane, but it's an airplane. And, you know, whatever the air circulation of an airplane, that's what is going on there. So how much of an issue is that in terms of the people that were riding with him on the plane?
And Savannah, this is going to be a big issue, especially going forward here, and that contact tracing, like Hallie said, is going to be extra important. So people that were close to him, especially within 6 feet if they're there for extended period of time, but even people on the airplane are going to have to quarantine. And the closer they were, the more they're going to need that quarantine period, and that's a 14-day quarantine period. And so that means that they shouldn't be out in public, they should be staying home, they should be avoiding other people, and definitely should be wearing masks if they have to be in interaction with other people. And so being on the airplane, we know ventilations on the airplane can actually keep the virus a bit under control, but in situations like that on Air Force One, where the seats aren't regular types of seats, they're moving back and forth. Again, everybody on that plane that was in proximity to him should be quarantined for 14 days, Savannah.
And I just have a few more moments with you, John, but for the president himself, he is, his doctor says he's well. That it doesn't really answer the question of whether he is showing any symptoms at all of the coronavirus, but he is in a risk group. He's an older gentleman. He's 74 years old. Are there other concerns you have as a physician when you look at the profile of President Trump having this illness?
And there are other concerns, and you're right. Above 65 is one of the risk factors. The other risk factor is obesity. And his last physical, which was June of this year, showed that he had a BMI of 30.5. So he was just on the edge of over into the obesity category. So that's one of the big risk factors here. So him having two puts him at that higher category of being possibly risky of getting critical symptoms from coronavirus and having complications from coronavirus. The other thing you have to remember is now that he has coronavirus, he's tested positive. He needs to not quarantine, but isolate for 10 days.
What's the difference?
Means since he had it October 1st, well, the difference being quarantine means that you think you were exposed, but you haven't started showing any symptoms or you haven't tested positive. So that means you need to stay home, you need to stay away from other people, but not necessarily isolate yourself from your family members. If you test positive, then you need to isolate yourself, and that means you need to stay away from everybody, and that means a very strict regime for 10 days, which if he had it October 1st, that means on October 11th, that's his last day of isolation. He's clear October 12th, unless he starts developing symptoms. If he starts developing symptoms, that clock restarts, and so that 10 days starts the day he develops symptoms. So the earliest he can get out of isolation per CDC protocol would be the 12th.
Okay, and we don't, in fact, know if he's showing any symptoms at all. Dr. Torres, thank you so much. Hallie Jackson, Peter Alexander, thank you very much. We will have the very latest just ahead this morning on Today, but the breaking news this morning, the president and the first lady both testing positive for the coronavirus. An announcement made on Twitter by the president himself. The president's physician stating that he is well, but will remain in isolation and continue his duties as president. Most of you will return now to your regularly scheduled programming. I'm Savannah Guthrie in New York. This has been an NBC News Special Report.
And here at home, we, of course, are keeping an eye on the president's condition and the first lady. You heard Savannah say they're not saying whether or not he's symptomatic right now, but we're going to stay on top of that, as well as the impact on the market this morning.
Yeah, we've seen the futures way down somewhere between 1% and 2% across the board. So we'll have to see as that goes. We'll check in with Maribel and maybe Karen Kaif in our Business News later this morning. Also, we got to get you out the door, though, right?
Right. Weather and traffic and local headlines after the break.